There are several things that make UVA one of the leading heart centers for our area, but I do think that the most important thing we have is excellent people. We have marvelous physicians, nurses, technicians. We have fantastic technologies that aren't available in other places in our area, but all that's meaningless if we don't have good people that can use the technology, interpret the results, and most importantly, communicate those results to the patients. I was about 4 years old the first time my father got admitted to the hospital with atrial fibrillation. And throughout my childhood, he got admitted to the hospital multiple times. So I know firsthand what it's like for patients and their families to deal with these chronic kinds of conditions. The most important thing to me as a physician is to make sure that my patients have a complete understanding of what their diagnosis is. These are not trivial things. These are important to patients, and so I want my patients to feel at all times that they can ask questions and really feel that they have a team of people taking care of them. The #1 killer of all Americans, men and women, right now is cardiovascular disease. And so part of our approach at UVA isn't just to treat conditions after they arise, we also want to prevent them. Many patients think that cardiovascular events can't happen to them, particularly women who in the past weren't focused on very much when we talked about reducing cardiovascular risk. Now we know that women are very likely to have cardiovascular events. One of the wonderful things about working in the Heart Center at UVA is right here we have a whole comprehensive group of physicians, nurses, and technicians that can deal with a whole host of problems. I deal specifically with heart rhythm abnormalities, but a lot of my patients also have heart failure, they have cholesterol problems and blood pressure problems, and having that group of specialists right here that can deal with those problems in one location is really amazing.